The selection of the rubber dam we use is based on considering several key factors. The first factor to consider is the size of the rubber dam that we want to use. Based on the size, the rubber dam is 6 inch in 6 inches or 5 in 5 inches. It is obvious that the bigger size is for the adult and the smaller size is for the children. The second factor to consider when categorizing rubber dams is their thickness. Typically, rubber dams are classified into 3 categories: thin, medium, and heavy. It is important to keep in mind that these thickness categories are not universally consistent across all producers of rubber dams, as the thickness can vary significantly between different brands. For example, consider these 2 rubber dams from different brands. The first is the thick rubber dam from Nictone, and the second is the thick rubber dam from Isodam. As you can clearly see, the Nictone rubber dam is much thicker. Generally speaking, when discussing the thickness of rubber dams and their use, thick rubber dams are preferable for restorative procedures. They facilitate better inversion, which is absolutely important for perfect isolation, but they are more challenging to maneuver through the contacts of the teeth. In contrast, medium rubber dams are easier to maneuver through the contacts between teeth. However, they do not achieve as effective inversion as the heavy rubber dams. The third factor for categorizing rubber dams is the material they are made from. Accordingly, rubber dams are divided into 2 types: latex and non-latex. As we know, some individuals are allergic to latex. If you typically use latex rubber dams, it is advisable to inquire about any history of latex allergies in your patients. For those with such allergies, ensure that you have non-latex rubber dams available in your office. Finally, another factor for categorizing rubber dams is whether they are flat or have a 3D design. The 3D rubber dam, such as the OptiDam by Kerr Dental, features a design that is particularly useful for certain cases. I will discuss when to use 3D rubber dams and how to install them in a separate video. Finally, after more than 12 years of experience with various rubber dams, my first choice for restorative procedures, where perfect inversion and prolonged isolation are required, is the heavy Nictone rubber dam. If my patient has a latex allergy that I cannot use the Nictone, my preferred choice is the heavy non-latex rubber dam from Isodam. For root canal therapy, I prefer a medium rubber dam. This choice is based on the fact that endodontic treatments typically utilize a single punch rubber dam, and inversion is not as critical as in restorative procedures. Finally, The only scenario in which I prefer to use the 3D rubber dam from Kerr is when I need to work on both the upper and lower jaws in a single session, and the patient is able to keep their mouth open for a relatively long period.